Hey YouTube, my name is Dr. Daniel Kaplan. I'm back with another video, part of my 30 for 30 series. Today we're going to talk all about substance abuse. So in the DSM-5, there were some really significant changes in how we conceptualize substance abuse, substance dependence, and we reformulated the disorder to substance use disorder. And in the video, we're going to learn all about why we did that. We're also going to learn the fundamental criteria for a substance use disorder. And then I'm going to give you some eye-popping statistics about substances of abuse. So if you like this video, give me the big thumbs up, click the notifications tab, subscribe for future videos. So without further ado, let's talk about substance abuse. I think it's always good to define our terms. When I ask you, what is a drug? What comes to mind? Probably you're thinking things like cocaine, heroin, LSD, some of these drugs. But the definition of a drug is far more broad than that. A drug is any substance other than food that can affect our mind or body. So it can alter our mental state, or we have physiological responses. And the term drug, usually people think of drugs as, like I said, harder drugs. But in the DSM-5, we switch over to the term substances of abuse or a substance use disorder. And we intentionally did that so that a person understands the word substance is to include things like alcohol and tobacco and caffeine, because a person can develop a dependency on these three drugs as well, which are probably not what you were thinking when I asked you what is a drug. So if we were going to look at statistics of just teenagers and adults, 1 out of every 11 teens and adults display symptoms of substance abuse or dependence. So let's talk about the disorder in a very broad sense. I'm going to have subsequent videos on each substance of abuse specifically, but today's video is about the general criteria for a person to be diagnosed with a substance use disorder. The first thing we need is a maladaptive pattern of substance use that results in some kind of impairment or some kind of distress. Typically, we are tracking a person's behavior for at least 12 months, and a person needs a minimum of 2 or more of the following features. They need to take larger quantities of this substance over a long period of a time, or over a long period of time than is intended. So if, let's take, for example, a person becomes dependent on pain pills. If the doctor prescribes 1 pain pill per day and a person takes 2 instead of 1, they're abusing that drug, right? So they're taking a larger quantity of the drug than is intended. Or if a person continues to take pain pills, even after they're no longer in pain, they're taking it for a longer period of time. So that's one criteria. We also see that if a person wanted to cut down or reduce their substance abuse or dependency, and they struggle and they can't, that unsuccessful effort or attempt is an indicator of a substance use disorder. Another thing is, even if a person isn't trying to cut down, but it takes over and becomes a preoccupation where a person is spending a significant amount of time trying to either obtain a drug, use a drug, or recover from its effects, that level of dysregulation or it taking over your life is an indicator of a substance use. Now, you don't need all of these. You just need a minimum of 2 of these symptoms for 12 plus months, right? If we see a person who start to dip on their obligations, whether it be at work, whether it be with their family, whether it be with a romantic partner, whether it be at school, right? So if we see that a person is no longer fulfilling their roles or obligations at work, that's an indicator of a potential substance use. Now, if this substance use caused some level of distress and dysfunction, and a person continues to use even though they know that it's causing some kind of reduction in performance, that's an indicator of substance use, right? The cravings for the substance, the tolerance, and we're going to define tolerance and withdrawal and all of these things, but tolerance and withdrawal, these features are indicators of a substance use disorder. Now, we are worried about substances of abuse or substance use disorders because we know that a person is going to develop long-term problems in the absence of working through their substance use disorder. So typically, if you continue to engage in use, you're going to develop a substance use disorder. Due to the tolerance, due to withdrawal effects, a person is likely to continue using both that drug and higher doses of that drug to either reach a previous high or to avoid withdrawal effects. And when that happens, we refer to this as an addiction or a substance use disorder. So you're probably wondering, well, why did we get rid of the terms abuse and dependence and replace it with overarching new category of substance use disorder? Why did we change the language? Well, it's easy to mix the word dependence with a term addiction. And some of the features of dependence might occur even in the absence of an addiction. So things like tolerance and withdrawal. Tolerance requires you to have a higher dose of a drug to reach a previous high. But even if you're not abusing a drug, through time, you're going to need more of a drug because your body and the metabolism is going to either upregulate or downregulate in order to adjust to this new chemical in the brain, right? So it's going to naturally adjust itself. So tolerance is going to occur and is a perfectly normal response to even prescribed medication that you're taking according to doctor's orders. So this sense of tolerance is very common. The sense of withdrawal, anytime you are not taking a drug, whether you're abusing it or not, in the absence of that drug, you're going to have what's called rebound effects, which is the opposite of what was happening when you are using the drug. So just because a person has tolerance or experience withdrawal symptoms doesn't mean that they have a substance use disorder, doesn't mean that they have an addiction, especially if the person's following doctor's orders to a T. So we didn't want to get the confusion of dependency and addiction and the criteria of tolerance and withdrawal as part of the dependency and addiction. We didn't want to get that confused. So we made a much broader sense to describe what we call substance use disorders. So that should alleviate some of the misunderstandings about tolerance and withdrawal. Now, tolerance, I said, but I want to put it on the slide so you could see it, is the adjustment in the brain or body that happens naturally as a function of regular use of a given drug. And because your body adjusts to what is being put in the body, your brain adjusts to the neurochemistry of what's being put in the body, you're going to need larger doses of a given drug to achieve earlier effects. Now, tolerance can be normal, but it can be a symptom of a substance use disorder as well. Withdrawal is when you're coming off the drug. So uh, if a person took a drug and they stopped taking it, you're going to have rebound effects. Some of these are very unpleasant. In the case of things like alcohol, these can even be dangerous. In my next video, we're going to talk about alcohol use disorder and the concept of delirium tremens, which can be potentially dangerous, right? So coming off of a drug, you can have unpleasant side effects that make people not want to come off of it, make them want to continue to use to avoid these negative experiences, right? So, but if a person's trying to get clean from a substance of abuse, we have to, go through the process of withdrawal in a safe and orderly process. So, what are the rates of substances of abuse or dependence? We see that the highest rates are amongst American Indians or Native Americans, with about 15.5% of individuals meeting the criteria for substance abuse or dependence, or substance use disorder, what we would call. 15.5 is roughly anywhere between 1 in 6 to 1 in 7. That is huge. Whereas when it comes to Caucasian, African American, Hispanic individuals, it hovers in around 9 to 10%. And we see that there's a significant drop off when it comes to Asian Americans at about 3.5%. So there's wide variability across the ethnic groups. But that being said, people who have a substance use disorder, only about 11% of these individuals seek help and receive treatment from a mental health professional. That's roughly 1 out of 9. So 8 out of 9 people who are abusing drugs or became dependent on drugs, they struggle with their developed dependencies, and they struggle alone many times. They struggle without treatment from a healthcare professional. So if we continue to look at the data on substance abuse, it's a significant social problem. We see that 22 million people in the United States have used an illegal substance in the past month. And about 1 out of every 4 high school seniors have used an illegal drug in the past month. So the numbers are staggering, whether we look at the general population or whether we look at even teenagers. 1 out of 4, that's roughly 25% of high school seniors, are using some form of illegal drug within the past month. Now, as a foundational slide for upcoming videos, we're going to talk about the various forms of substance use disorders. And the way we do, we put them in different buckets. We talk about depressants. In the depressant category, that's what slows down the central nervous system. We're going to discuss things like alcohol. We're going to discuss things like benzodiazepine, things like Xanax. We're going to discuss opiates. These are the classic central nervous system depressants. Then we're going to talk about stimulants. And then when we come to stimulants, we're going to talk about cocaine. We're going to talk about amphetamine. But we're also going to talk about caffeine, right? So caffeine is an interesting drug where a person can develop tolerance and have negative withdrawal side effects from coming off of caffeine. But we'll get there. When we talk about hallucinogens, we're going to talk about things like psilocybin and LSD. And then we'll finish up our categories of substance of abuse with a discussion on cannabis. And cannabis is a very complicated drug because it has properties, depending on the strain, that are depressant in nature, some that are stimulant or excitatory in nature, and some strains of cannabis can even induce pseudopsychotic states like hallucinations, paranoia, and whatnot. We will get there. But this video, I hope, will serve as a primer for the concept of substance use disorders, understanding the general criteria, understanding the various categories of drugs, and the significant data on how it impacts society. So if you like this video, please, please, please hit the like button, click subscribe, click the notifications tab, and this will allow the video to go to a larger audience. But that's not it. Like, I want this to be a learning community. So if there's anything that you want a video on, write it in the comment section below. I read every comment, I respond to every comment, and you will be the source of a subsequent video. Until next time, people, have a great day.